Knock, howdy, folks. Dr. Ben here. Thanks for tuning into the Dr. Ben and Friends podcast. All right, our next segment is What the Heck? WTH, Whiskey Tango Hotel, where our guest comic, Dr. Drew.
Hello. Still
Davis,
doctor. Love it.
is going to read, pronounce, and explain what certain medical terms are that Dr. Steve, oral maxillofacial surgeon, uses every day. And so, kind of like that game Balderdash, if you guys ever played that, where you see a word, an uncommon word, and you try to make up a definition for that.
Let's do it. I'm sure I know every single word and every definition.
We'll start easy.
Okay, Dr. Steve, show him the first word, Dr. Steve.
Oh my gosh. These are English words, right?
Yes, they are.
Okay, English language. Okay, so this looks like, a cleft lip repair. So that's what the word clearly says, cleft lip repair.
Okay.
Yes.
And it means when you have a cleft lip and you need to repair it, but it's not how you think it is. It's not with your actual lip. It's actually when the front of your car is damaged, you have to take it in to get it fixed.
I like it. It's a trick one.
I knew you were going to try to stump me. I was like, nope, I'm not falling for it.
I think you were closer with the first part of your answer.
And Dr. Steve can tell us about
A cleft lip repair is, unfortunately, when roughly about 1 in 700 children throughout the world are born, may exhibit some type of cleft lip or palate repair. The lip repair is actually done at a very young age so the child can actually nurse and learn how to speak. But yes, it's basic repair of the lip, readjusting the lips and the musculature to become functional and aesthetic again.
Wow. And there's like a hard and a soft palate, isn't there?
Yes, there is.
Okay.
Huh.
Just interesting.
Mm-hmm.
Fun fact. I'm just a bone doctor. I don't know too much about.
So this one's a bone thing.
Okay, next.
Oh, okay. LEFORT Osteotomy.
Okay, good.
Osteotomy? LEFORT?
My question is, what the heck is that?
Right. Well, it's actually... This is another trick one because I was assuming it was medical terms, but
Right.
LEFORT Osteotomy was a general in the Confederate side of the Civil War, and
Sponsored by the French.
right, absolutely.
LEFORT. So,
Osteotomy is a version of astrology where you, instead of thinking about the stars, you're thinking about the bones and like, what are you? Are you a meniscus? Well, then that means you have a personality. I don't know. But LEFORT Osteotomy. I have no idea what a LEFORT is. It sounds like something a tree nymph would have.
So you were actually closer with your Civil War reference because LEFORT osteotomy also goes along. There's a LEFORT fracture, but all these came from a French surgeon, René LEFORT. LEFORT.
Okay.
Who developed a classification system initially for looking at traumatic injuries of the midfacial region. And there's 3 types of LEFORT.
Okay.
There's one that is just a horizontal fracture across your palate type of deal. There's that's a LEFORT 1. And LEFORT 2 is where you actually have a pyramidal fracture that incorporates your upper jaw and your nose. And then a LEFORT 3 incorporates the whole midface. So your upper jaw, your nasal, your cheekbones, the bottom of your orbits, all is one big fracture segment. The cool thing with it is the way he developed these classifications is he took a bunch of skulls and then threw them down these concrete stairs.
Whoa. And looked at their fracture patterns?
And looked at the fracture patterns and realized that there were 3 major fracture patterns. Someone had to start somewhere, right? So the LEFORT osteotomy is actually a procedure where you electively cut the jaw in that horizontal pattern for kids and adults that have a dental facial deformity, like where their bites don't occur, they have their midface is behind. So the LEFORT osteotomy is actually where you make that cut and bring the lower jaw usually forward to reposition it in a different place to help the person's bite.
That's actually really interesting. I can't wait for someone to ask me today, like, what do you know any French medical terms,
Right.
or French doctors in the medical field? I'm gonna sound so smart.
I think he was saying that if we don't come up with a classification system, heads will roll.
Yeah, they did.
They
With
really
a little
did.
help. All right, next one
Let's do it.
in the same mode.
Okay. Sagittal split osteotomy. Okay, Osteotomy. A sagittal split sounds disgusting. That sounds like not something I would be able to talk about on a clean comedy show.
Okay, yeah, we are clean.
So, or it's. But that was my first thought. My second thought, I figured it out. A sagittal split is when some part of your face, like for example, your chin or something, starts sagging. And a lot of people, and that can create some problems medically, like how you can chew with it, or it could be your ear, it could be your cheek or whatever. It could
Starts sagging.
And so obviously the doctors have to perform the sagittal split surgery to get things back in order.
So
does it have anything to do with astrology and Sagittarius?
No.
Okay.
No, and my high school had a
just making sure.
planetarium, and I never knew these in high school. Or planetarium. The guy who ran our planetarium, that's how you pronounced it. Planetarium. So a sagittal split osteotomy goes along with the LEFORT osteotomy. The sagittal split osteotomy is actually the procedure that's done on the lower jaw, the mandible, to cut that in a sagittal manner, which means like front to back. And then you cut it and it can slide the tooth part, the dentition part of the teeth, to help line the teeth up on people that need to have dental facial deformity corrections.
Huh. Well, I wasn't super close with that one.
Not far off, though. The sagging chin.
Yeah, I did reference the chin on
We're
accident.
bone doctors. You have to keep it simple. Okay, next.
Okay.
You might get this one.
I don't know. I don't know many of these.
Distraction osteogenesis. Does that say distraction or distraction? No, it's distraction.
I can hold it that way if it makes it easy.
At this point, it looks about the same upside down or right side up.
Distraction's probably the
osteogenesis is clearly the birth of bones.
okay.
Yeah, wow. Look at
In
that.
the beginning,
So,
there was
In the
bone.
beginning, there was bone.
And distraction sounds so close to distraction. This is when, if maybe your patient is like a ninja or like a warrior, and you need to give them fake bones. So that in battle, someone might try to break their arm, but oh no, they broke the fake arm or whatever. And then you can sneak attack.
I like it.
Or you may be trying to confuse the osteogenesis.
Yeah, absolutely.
Yeah, so we're trying to distract the osteogenesis from occurring.
Yes.
Right. Don't look over here.
Don't look over here.
It's like a magic trick.
Right. Smoke and mirrors.
So distraction osteogenesis is something that mainly occurs in pediatric patients that are born with very tiny jaws that can't support their airway. So what you do in distraction osteogenesis is you go and you make a cut in the bone, and then you put this external fixator, which has like pins that come out of your face type of deal, or a thing that comes along, and it's got a little lock and key. And it's got a little thing that you twist like a turn a day or a quarter turn a day, and you slowly move the jaw out, maybe a quarter millimeter of the day to actually bring it out where it's supposed to be. And then once it's held into place, you then hold it there until all the bone consolidates. So you stretch the periosteum over top of the bone, and you're sort of distracting the bone cells, and they actually lay down and grow new bone.
Huh.
We can do leg lengthening procedures.
Right, same thing.
Yeah.
Oh, that's really cool.
We can make you taller.
Could you make me thinner? Was there is there the opposite? Like you push?
That's the rack. They just stretch it.
Yes.
So that's why I thought you would get that one.
Right.
You'd get this one. This is a answer to a classic question that
On
oral and
Jeopardy?
maxillofacial surgeons get like on their boards.
Wow. Okay.
Really?
So
when you get this one, this will be very impressive.
We're hopping up here. You get this one right, then I'm going to give you you'll be an honorary. Besides Dr. Drew, you become an honorary oral and maxillofacial.
Oh my gosh, the pressure's on. I got this.
With the ability of probably at that point to bill insurance companies for your opinion.
I love it. Yeah.
Because you'll get the same reimbursement.
Right. All right. Well, I know the second word is suture. I've heard that one before.
Suture. Okay.
So the first one for our listeners, it has every list. It has every letter in the alphabet. It is SPHENOZYGOMATIC suture.
Very good. Very
wow,
close.
impressive.
All right.
I think I've seen that on Wheel of Fortune before.
Yeah, sphenozygomatic suture. It's
Yes.
right under the one that says $1 million if you put it out.
that is quite a word. Okay, this one, again, relatively obvious what it means. Obviously, it's a suture that you're doing. But here's the thing. Sphenozygomatic sounds very similar to me as schizophrenic. So I think it's when you're going in to do one suture, but then you either decide or are led to believe that you need to do a different suture. So in mid-surgery, you change it, and then it ends up being the correct thing that you needed to do. It's a coincidence, but it's also such a big deal and rare enough that they had to come up with a term for it.
I like it. How close was he?
I'm amazed.
Wow, how did he get
I
that?
am 100% amazed.
Was that at all? No
We're gonna
way.
make him an honorary.
I mean, you got it.
Oh, are you serious?
No, you're not even close.
but we had you going.
Not even in the ballpark. So
I liked his response.
Had
though.
high hopes after you said that.
So there's two types of sutures. You have the suture that are like the strings that when we sew things together, but also we've talked a lot about bone today. When bones form and grow together and different bones come together, the area where one bone maybe lays against another bone is called a suture. So the sphenozygomatic suture is where the sphenoid bone and the zygomatic bone come and lay together.
What are those?
And it comes along this long line. So
Hands.
it's the connection that makes the lateral and superior part and everything of your eye socket. So when we're actually fixing someone's cheekbone, their zygomatic bone is their cheekbone. One of the things that we look at to make sure that we've got things in the proper position, because remember earlier we talked about all the bones being curved and stuff. If we can get that curvature to line up and get that bone to tuck in along the suture and check that, then we know that we have the person's cheekbone back in the normal proper position. So that's the sphenozygomatic suture.
That's really cool.
Think you could use that in conversation later today?
I'm going to try.
You might get
Okay.
slapped.
The sphenozygomatic suture.
Looks like whoever did your sphenozygomatic suture did a real good job.
Yeah.
You might get slapped in the
Yeah.
sphenozygomatic suture.
Gotta be careful with that.
All right. Thank you so much, listener. Thank you, Dr. Drew, Dr. Steve. Word games are a blast. Love them. So
That was What the Heck?
stellar work. That was
What
what
the
the
heck?
heck? What the heck is
Dr.
that?
Ben and friends.